he asked Republicans to bring him ideas that could fix America's broken health care system. For example,
folks who are criticizing it don't seem to have any ideas in terms of how to reduce costs, ensure millions of people get coverage for the first time. I will work with anybody to implement and improve this law effectively. You got good ideas? Bring them to me. I'd be happy to listen. But that's not what's happening.
Well, our next guest says not true. Congressman Tom Price is a Republican from Georgia. He said he's got a proposal that could save this country trillions of dollars. Good morning and welcome.
Good morning, Elizabeth. Thanks so much.
So here's your idea. The president asked you for an idea. What's your idea?
Well, what we do is put patients and families and doctors in charge of health care as opposed to Washington, D.C. When the president says that, the American people know that he's not telling the truth. We've had plans out there for over 3 or 4 years that would fundamentally change the health care system. So, again, patients and families and doctors are making decisions, not Washington, D.C. We've got to make it so that folks can get health coverage, but it's coverage that they want, not that the government forces them to buy.
What are the basic differences, though, in terms of purchasing across state lines? Is that a possibility?
Purchasing across state lines, making sure that you equalize the tax treatment for individuals so that folks have the same tax incentive to purchase health coverage as businesses. You make it so that every single American has the financial feasibility to purchase coverage through deductions and credits and advanceable credits and refundable advanceable credits. Then there are wonderful ways to save literally hundreds of billions of dollars in health care by ending the practice of defensive medicine.
And, of course, not only do you know this, and are you on you're the vice chair of the Budget Committee in the House, but you're also a doctor.
Yeah.
So this is what the former, I would imagine, could have been somewhat of a surprise, but a pleasant surprise. The former CBO director said this about your plan. It will produce $2.34 trillion in savings over the next 10 years, will create smaller premium increases than the Affordable Care Act, and the number of insured could increase by 29% in 2016. But do you handle people with pre-existing conditions?
We do, by making it so that they can get, again, the coverage that they want, not that the government forces them to buy. The problem with the president's plan is that if they don't think your pre-existing condition is a pre-existing condition, well, you're out of luck, because nobody wins an appeal with the federal government. We allow people to pool together with millions of other Americans, so you get the purchasing power of millions, so that one person's adverse health status doesn't drive up the cost for anybody else.
So you're saying that the government that will decide what plans are out there is going to decide what qualifies under those plans with that panel?
Without a doubt. And they're going to define what doctors you can see, what drugs you can take, what formulary of drugs will be available to you. This is just beginning to unfold, and the American people know it's wrong.
So you've answered the president's question. If you have any good ideas, I want to hear it. Now, what you're saying is, I'm not going to fix your plan, Mr. President. It's not fixable. You're saying, go with my plan, and when is this going to be presented?
Well, we've presented, it's H.R. 2300, the Empowering Patients First Act, and this is the third Congress this has been introduced. We had it when the president made his statements early on with Obamacare. If you've got another idea, give us a call, let us know. We've actually called them. We've contacted the White House repeatedly, and silence. It's crickets. The fact of the matter is they don't want to talk about the quality of health care, accessibility to health care, affordability of health care. What they want is the government to control health care.
Do you have Obamacare?
We were forced onto it because of the law, yeah.
And what have you found?
I've found that so far it's more expensive than what I had previously, and as I'm able to determine, it looks like the panels are going to be smaller, and that's going to be true for the vast majority of the American people as they work through this, and we see that it's going to cost more, accessibility is going to be less, and the quality, I believe, is going to be less as well. That's not right. That's not what the American people want.
Well, that's what we're getting.
We have support behind you on this.
Thank you.
In terms of what I've read so far, and so we wish you well, Congressman. Thank you for being here.
Thanks so much. Merry Christmas.